Welcome back to Winning Isn't Easy. Extra flexible joints, chronic pain, and stretchy skin. What ERISA Disability Carriers don't get about Ehlers-Danlos Syndrome. Ehlers-Danlos Syndrome was first described in the medical literature by a Danish physician, Edouard Ehlers, and a French physician, Henri Alexandre Danlos, in the early 20th century. Now, I will tell you that unfortunately, many ERISA disability carriers or plans take a 20th century approach to handling an ERISA disability claim for Ehlers-Danlos, known as EDS. EDS covers 13 genetic connective tissue disorders characterized by hypermobile joints and stretchy, velvety skin. But there are subtypes of EDS that disability carriers don't appreciate. They kind of lump EDS in a big bucket. There's hypermobile EDS, HEDS, which involves joint instability, dislocations, joint pain, and fatigue. There is brittle cornea syndrome, BCS, where the cornea becomes thin and fragile. There's also periodontal EDS, PEDS, where the tissue that supports your teeth break down. Now, Ehlers-Danlos syndrome and its subsets impact the skin, the skeleton, and the internal organs. And obviously, it can result in an inability to do your own or any occupation. Let's talk about the diagnosis of Ehlers-Danlos syndrome. Unfortunately, many will wait years before the onset of symptoms before getting a correct EDS diagnosis. And it's not because they aren't seeing physicians, it's because doctors don't always get EDS. That can play into an ERISA disability carrier or plan's hands because disability carriers expect there will be a diagnosis. I find that misdiagnosis, proper diagnosis, be hard because it's commonly associated with other disabling men, and carriers don't understand those, much less EDS. Those disorders can include POTS, digestive disorders, sleep disorders, and anxiety disorders. And when the carriers see all these multiple diagnoses, the adjuster's head just spins. They don't know what the correct diagnosis is. They don't know what the combination of diagnosis means. They don't know how to evaluate each individually or in combination. And they don't even understand how each individually can be disabling, much less the combination can be disabling. There are very few providers who specialize in the spectrum of these disorders, and hopefully you're being seen at one of the 18 centers of excellence in the United States that specialize in EDS. Now, that's crucial because disability carriers are always looking for a reason to deny a claim on the basis of no diagnosis or that your symptoms don't neatly fit into the diagnostic criteria and therefore could not possibly be disabling. The longer you go without a diagnosis, the more likely it is the carrier is going to deny the claim. Because as they like to say, symptoms aren't diagnoses, diagnoses aren't necessarily disabling. So we've got to address this in your medical records. And if you're treating at one of those 18 centers of excellence, they generally know how to diagnose and document the diagnosis of Ehlers-Danlos. Now, one of the other issues that I see in these claims is the treatment of Ehlers-Danlos syndrome. Disability carriers and plans require generally that a person get appropriate medical treatment for their condition. And what will happen in an Ehlers-Danlos case is the disability carriers or plans will criticize the policyholder who hasn't gotten specialized treatment, which of course can be difficult because it's hard to find a doctor who is proficient in diagnosing and treating EDS patients. Again, it is really crucial that whoever your physician is, that they document the basis of the diagnosis, the objective physical findings, the objective diagnostic studies, outline your course of treatment and your response to that treatment, and of course, comment on restrictions and limitations. Now, let me give you a real life example. People like Selma Blair, who's a Legally Blonde star, have had trouble being taken seriously. She had chronic pain and stiffness that clearly makes it hard for her to be an actress. And she has pointed out that the treatment, it really is a team approach treatment. It's a team approach not only with you and your doctor, but if you're filing a disability claim, it also involves an ERISA disability attorney. in my view, it's really crucial that you are working with an experienced Ehlers-Danlos attorney who understands these claims. I handle Ehlers-Danlos claims not only for ERISA LTD claims, but Social Security disability claims. And I will use what I do in my Social Security claim in my long-term disability claim. We Social Security lawyers have developed Ehlers-Danlos residual functional capacity forms, which I think are a heck of a lot better than those disability carrier plans attending physician statement forms. So we will use a Social Security disability Ehlers-Danlos residual functional capacity form, not only in the Social Security claim, but also as an addendum to the attending physician statement form in the disability claim. So we're coordinating claims, we're coordinating proof, and we understand what the elements are of a diagnosis, what we expect to see in terms of symptoms, what we expect to see in treatment, in response to treatment. So we're putting together, as you should, a very linear, accurate story of the nature of your medical condition, its progression, its symptoms, and your treatment. You want to get the disability benefits you deserve, regardless of where you live, regardless of the carrier, and the proof is essentially the same. So give some thought to that. Let's take a break for a moment.